Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, best foods to speed up recovery after surgery. If you've had surgery, the foods you eat in the days, weeks, and months after your operation can affect your healing and recovery. Eating the right foods and avoiding the wrong foods can keep you healthy while preventing complications like constipation and postoperative infection. /r/n/r/n Sometimes, eating post-surgery is difficult. However, there are several tips and options if you don't have an appetite or are too uncomfortable to eat. What type of surgery you had may also impact the foods you can eat post-surgery. /r/n/r/n The type of surgery you had and any pre-existing conditions you have will determine which diet is most appropriate for you. /r/n/r/n For example, :/r/n/r/n Remington Stocksy Unitedrnrn/r/n When stocking up before your surgery or getting back to shopping after surgery, take a look at your regular diet and see if there are any positive changes you could make. This may include eating more whole, minimally processed foods. /r/n/r/n An easy way to find whole foods is to start in the produce and meat sections. /r/n/r/n Whole foods are much healthier than processed foods, which tend to be high in sugar, salt, and fat and low in fiber. Processed foods may also contribute to inflammation, which could slow healing. /r/n/r/n Fresh fruit /r/n/r/n Baked potatoes /r/n/r/n Chicken breast /r/n/r/n Onions /r/n/r/n Fish /r/n/r/n Bananas /r/n/r/n Ground beef /r/n/r/n Fruit punch /r/n/r/n French fries /r/n/r/n Chicken nuggets /r/n/r/n Onion rings /r/n/r/n Fish sticks /r/n/r/n Banana chips /r/n/r/n Fast food burger /r/n/r/n Your surgery could provide the extra incentive you need to make lasting changes to your eating habits. Eating whole foods supports your good health during recovery and every day after. /r/n/r/nanakopa, istockrnrn/n/r/n Constipation is common after bowel surgery, but it can also happen after any surgical procedure. One reason is that prescription pain medications sometimes used after surgery, especially opioids, can slow bowel movements and create hard-to-pass stools. Being constipated can also reduce your appetite, increase your pain level, and put stress on surgical incisions. These factors can get in the way of your healing. /r/n/r/n Some foods may prevent or treat constipation, while others that are low in fiber can increase the risk of constipation. /r/n/r/n Generally, avoid low-fiber foods until you're back to having regular, soft bowel movements. Foods to avoid include /r/n/r/n Alcohol and caffeine can have a diuretic effect on the body, causing dehydration and constipation, so avoid these beverages after surgery. /r/n/r/n One key way to prevent constipation is to get enough fiber. This is especially true of insoluble fiber, which increases the speed stools move through the digestive tract. /r/n/r/n Consider adding these high-fiber foods to your diet while you are healing. /r/n/r/n Taking a fiber supplement, like psyllium, is another way to boost your fiber intake, although you won't get the nutritional benefits of whole foods. /r/n/r/n It's also important to drink enough fluid while you are healing. Dehydration can worsen constipation and make fiber in your diet less helpful. Most experts recommend drinking 8 glasses of water per day, a target that may be all the more important while recovering from surgery.rnrnVkuslandia, istockrnrn. Dietary protein is key for your recovery as it provides the building blocks for new tissues and muscles. /r/n/r/n. That said, some protein sources are high in saturated fat, particularly red meat and processed meats. Overeating saturated fat places inflammatory stress on the digestive tract and can cause constipation. /r/n/r/n. Instead, choose lean protein foods such as /r/n/r/master 890. Stock/r/n/r/n. Whole grains are an excellent source of vitamins, minerals, and fiber. They also help keep you regular by delivering a healthy dose of fiber to your diet. /r/n/r/n. However, not all whole grains are created equal. White rice, for example, is heavily processed and doesn't offer as much nutrition as brown rice. It can also be constipating, while brown rice can help alleviate constipation. /r/n/r/n. Healthy sources of whole grains include /r/n/r/nleonori, istockrnrn. Fresh fruits and vegetables are excellent sources of fiber, vitamins, and minerals that support healing following surgery. /r/n/r/n. Even so, you may need to control your intake as overindulging in certain fruits can cause diarrhea, while overindulging in certain vegetables can cause bloating. Both can place stress on the intestines after bowel surgery and impede healing. /r/n/r/n. Fruits high in a type of sugar called fructose may need to be limited while you are recovering from bowel surgery. These include /r/n/r/n. In the same vein, vegetables that are gassy may need to be avoided until your digestion settles. These include /r/n/r/n. Stitchik, istockrnrn. Reduced fat and non-fat dairy products are excellent sources of protein, calcium, vitamin D, and minerals that aid in wound healing, magnesium, zinc, and selenium. /r/n/r/n. However, if you experience constipation when consuming dairy products before surgery, you should limit dairy products after surgery. /r/n/r/n. Those with pre-existing lung disease can experience more coughing and lung secretions after eating dairy. For these people, dairy may need to be limited following surgery. /r/n/r/n. The same may apply to people who have undergone chest surgery or have a persistent cough after abdominal surgery. Coughing can place undue stress on incisions while healing. /r/n/r/n. To be safe, take it slow and try low-fat options that are easier on your digestion, such as /r/n/r/n. Anna_Shepilova, istockrnrn. After you have surgery, you might not feel like eating much. If you're having nausea, vomiting, or abdominal cramping, you may not want to eat at all. /r/n/r/n. Your appetite should return within a few days of surgery, but it's important that you maintain nutrition as best you can in the meantime. /r/n/r/n. To maintain strength, try eating small amounts of bland foods throughout the day, focusing on calorie-dense foods. These foods pack a lot of protein and other nutrients in a smaller amount of food. /r/n/r/n. Examples of calorie-dense foods include /r/n/r/n. You might also find it easier to drink rather than eat after mouth, throat, or stomach surgery. Focus on foods like smoothies, chicken broth, creamed soups, or protein drinks you can either drink or sip through a straw. /r/n/r/n. If you have stomach upset, try sipping peppermint tea or flat ginger ale or suck on ginger candy. /r/n/r/n daisy daisy /istock/r/n/r/n. If you are having a hard time getting enough calories in your diet after surgery, there are strategies that can help. /r/n/r/n. In addition to choosing calorie-dense foods, try these 7 easy fixes. /r/n/r/n. Eating plenty of nourishing foods after surgery helps your body recover, supports wound healing, and prevents constipation. With that said, you should check with your healthcare provider or a registered dietitian about the specific foods you can and cannot eat based on your surgery and general health. /r/n/r/n. In general, focus on whole foods, and avoid processed foods that are low in fiber and high in sugar and saturated fat. Even if you have no appetite, you can maintain optimal nutrition by eating smaller, calorie-dense meals rather than sitting down for 3 large meals you cannot finish. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.